Cancer researchers at Stanford University are about to start testing a new cutting-edge medical trial on humans, a trial that had a 97% success rate in mice. Joining us now is Clinical Associate Professor for NYU School of Medicine, Dr. Devi is here, and we're glad that you are because this trial is getting a lot of attention. Stanford heading it up, but it had huge success in now human trials, Doctor.
Yes, so they're about to start the human trial. So this is exciting. I mean, it's a small human trial that's coming up. It's looking at lymphoma, so it's not all types of cancer. But the idea here is that you're using something different than the traditional methods of treating cancer. So we're not talking about chemotherapy where the philosophy is to kill as many cells as possible. Instead, we're trying to ramp up the person's own immune system and have their own immune cells attack the cancer.
And this is really the new wave, is using the immune system to fight off and get rid of these tumors.
Exactly. So this past fall, we saw CAR T therapy, which is another type of immunotherapy coming out. The difference here, so with CAR T, what was happening was people would take out the person's own immune cells, kind of modify them, and send them back to fight the cancer. In this case, what you're doing is you're taking these different agents that cause the immune system to attack and injecting the cancer directly in one location. And then by doing that, maybe those cells will start to recognize the cancer. So that's why it's being called a vaccine.
What types of cancer are you optimistic that this could treat?
Well, the study in humans is going to be on lymphoma. The study in mice was on lymphoma, breast, and colon cancers. And the reason they picked those, so it doesn't apply to all cancers, at least not at this time, but the reason they picked those is, for example, let's think about colon cancer. You know, you go for a colonoscopy, right? There's cancer maybe in a polyp, but for some reason the person doesn't really have a lot of symptoms. You know, the cancer is invisible to the immune system. So it's there, but your body's not really reacting. So the whole idea of this vaccine is that you're teaching the immune system that there's something abnormal there and that it should attack it. You're trying to get past that invisibility factor.
Is the medical world really optimistic based on what you've discovered so far?
Yeah, so people are very optimistic because it's a whole new wave, as you said. This is a completely different way of trying to fight cancer. But at the same time, I don't want to be overly optimistic because
we'll see how it goes. Dr. Devi, it's great to see you, and I know you just had a baby, so congratulations.
Thank you so much.
Welcome back. Good to have you here.